Hi, this is Teresa. I'm going to do a video demonstration of a baby bath. So before I start, I'm going to make sure I have all my supplies so I don't have to leave the baby in the middle of the bath to get anything. And even if I do, I have to make sure I have my hand on the baby before I turn around and grab whatever I have to get because the baby can fall even though the baby hasn't rolled over yet. So now that I have everything available, I'm going to make sure the room is at a 75 degrees to keep the baby warm so the baby doesn't get cold. I'm going to fill my tap with warm water to a level that when I put the baby in, the water will not go to the baby's face to cause any aspiration. So I'll fill the water to a desirable level in the basin and then move the faucet away and also check the temp strip to make sure the water is at the right temperature to prevent burns. So now that I have my water ready, I'll wash my hand and wear my gloves. I'll put some gloves on. So the reason I wear a glove to do the baby's first bath is because the baby just came out of the woman's vagina and you don't want to cause any contamination to yourself as a nurse. So if you don't wear a glove, it's as if you are going into the woman's vagina with your bare hands. So you want to wear gloves to do your first baby bath. So I have my gloves on and then my baby is already stripped off. Yeah, the baby doesn't have any clothes on. So I will put the baby in the water, the warm water, with the swaddler or the receiving blanket, whatever I have covered the baby. So the water, I don't have no soap in the water. It's just plain warm water. And I want to say this. The baby doesn't need a bath every day. Twice a week, it's okay. You don't want to do it too much to cause the baby's skin to dry. So you don't need any complete bath every day. Um, the baby doesn't need any powder or any baking soda because it's not good for the baby's respiratory system. It's very dangerous if inhaled by the baby. You don't want to put any lotion or any baby's oil on the baby's skin. Those also can clog the baby's skin pores, so you don't want to do that. So I have the baby in the water, I have my washcloths, and before I start, I'll make sure I have a towel or a receiving blanket ready to put my baby on when the bath is finished. So I have it also available. So I'm gonna start washing the baby. And always when you're washing your baby, you wanna go from clean to dirty. So I'm gonna demonstrate how I wash the baby's face. And of course, I'm not gonna do this, but for the purpose of demonstration, I'm gonna do this so you can see the baby's face. So with the plain water, I will wash the baby's eye from inner canus to outer cantus, and I'll change the position and do the other eye from inner to outer. The reason you do that is you don't want to transfer any infection from one eye to the other. So if you wash the baby's eye, you want to change the position of the washcloth, and also you don't want to put no soap in the baby's eye, so you just use plain warm water. So the baby's eye is done. I will wash the rest of the baby's face. I will wash the back of the ears, both ears, and then the inside of the ear. I will only use one finger to do that. You don't want to put anything smaller than your finger in the baby's ear because the baby's eardrum is close to the outside, to the surface of the ear, and you don't want to damage it. So nothing smaller than your finger goes in the baby's ears. So now that the baby's face is done, I'm gonna do the body, the the body of the baby. I'm gonna start from the top. So that one I will use soap. So I will put soap on my glove hand, rub it, and then wash the baby's neck. the baby's arm, the inside of the baby's hand in between the fingers, because the babies put their hand in their mouth and they leave saliva in their hand. So you want to clean that, so the next time they put their hand in their mouth, they are not reintroducing any germs. So you want to do that. And the baby's chest still has, the baby's belly still has the umbilical cord, and you want to take care of it. So you want to wash around it. And whilst you do that, you want to make sure that there's no bleeding and there's no infection. I'm going to stress that. Make sure there's no bleeding or no infection. And if there is any sign of bleeding or infection, you want to call the baby's doctor to let the doctor know. So there's no swelling, there's no bleeding, and if there is, you have to let the doctor know about it. And the umbilical cord will fall off between 7 to 10 days. So just make sure it's dry and nice, and look, it doesn't bleed or it's not infected. So I'm gonna wash around it. So now the baby's top is done. I'm just gonna squeeze water to rinse the baby's top. And I'm going to cover the baby whilst I do the bottom, because you don't want the baby to get cold. So the baby's top is covered. I'm going to do the bottom. And with soap, I'm going to wash the baby's legs. And then rinse it. And the baby's peri area, you want to use soap, and also to wash the groin of the baby's peri area. And let me talk about how you would do peri care. So if the baby is a girl and you are wiping the baby or washing the baby's peri area, you want to always wash from front to back, front to back. And the reason is you don't want to cause any fecal contamination to the urethra. You don't want to bring any dirty stuff from the back to front to cause any infection to the urinary tract, yeah, urinary tract system. You don't want to cause any infection like UTI. So you want to always wash from front to back. And babies, baby girls, for the first week to the second week will have this thick mucus, or sometimes they will have blood in it. It's normal. This is because they are withdrawing from their mom's hormones. So you will see that there's no cause for any alarm. And also between the labial folds, there will be vernix, and the vernix is a cheesy white thing in the labial folds. So you want to also clean that with every wash or every diaper change, and it will gradually go away. So you want to also do that for the baby girl. And you want to check for any redness or any rashes in the peri area. If there is any rashes or any redness, you want to document that and let your doctor also know about it. So that's for baby girls. If the baby is a circumcised baby boy, you want to also, same way, use soap and water to wash the groin, and just squeeze plain water, warm water on the penis, the top of the penis. There will be a formation of granulation tissue. This is good. It's like a yellowish, whitish tissue. It's like it will form at on where the circumcision occurred. You don't want to wash that away. It's good. It means the circumcision is healing. So when you are washing the baby's private area, you don't want to wash that off. Leave it and let it heal. Also, you will check for any bleeding and any infection. Same for the umbilical cord. You want to make sure there's no bleeding or there's no infection, like any odor or any swelling or too much redness and yeah, swelling. You don't want to see none of that. If there is, you have to always let your doctor know. Check for rashes and redness also. And for the first 24 hours, you will put, there's this ointment, like a petroleum jelly. You put it on a 2 by 2 gauze and put it on the tip of the penis. So when you put a diaper on, it doesn't stick to it. Also, with every diaper change, you want to put warm water on the penis, the top of the penis, pat dry before you put the diaper on until the circumcision is healed. You want to do that also at all times. If the baby is uncircumcised, you don't want to forcibly retract the skin of the penis because it can cause swelling to the glands, and you don't want that. And also, it might not return to the normal position. So you don't want to forcibly retract the skin. So you just want to use water, soap and water, and then just wash it gently, and then rinse it and pat dry to no forcefully retraction. And also you will check the baby's groin and the peri area to make sure there's no redness or any rashes. Also, as the baby grow, the 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 foreskin will loosen naturally. So you don't want to retract it now because it will be hard to go back to the original position, and it may also cause swelling to the gland. So you don't want to do that. So now that my peri area is done and the legs is washed, I'm going to wash the back of the baby. And then you just turn the baby like that. You just wash the back. You don't have to lift the baby up. So my baby is washed and done. My towel is ready. So I'm just going to put my baby on the towel here and then dry the baby. Same way, make sure you dry the umbilical cord very dry. The basis of it has to be very dry because you don't want to leave it wet. So you dry very well and take care of the uncircumcised penis too. Make sure you don't dry too hard to pull the skin foreskins. And also with the circumcised, you don't want to wipe off the granulation tissue. You don't want to wipe it. And with the female, you wipe from front to back. So that is done. I'm going to wash the hair of the baby. I'm going to make sure my water is changed. So I'm going to fill it with warm water. Same way, check the temp strip. Make sure it's nice and warm. So I'm going to use a football hold to wash the hair of the baby. So don't be scared to wash the baby's hair because you're not going to hurt any soft spot. So just wash it. Make sure every amniotic fluid and every blood is washed off. So it's washed, rinse. Oh, of course you wash with soap. Wash and then rinse and then you dry. So the hair is washed. I have my halo sack available here. So for the purpose of the demonstration, I'm going to get this out of the way so you can see what I'm doing here. So the baby is on the halo sack. And the importance of the halo sac is it prevents SID. And when we say SID, it's sudden infant death syndrome. So as part of the Back to Sleep campaign, they are promoting using halo sac to put your baby to bed to reduce the SID, to reduce SID. And let's talk about SID before I move on. To prevent SID, you don't want to put anything in your baby's crib. No pillows, no extra blankets, no stuffed animals, no bumper pads, nothing but your baby on a hard, on a firm surface. That's what you want to do. And for the first 6 to 1 year, you always want to sleep in the same room with your baby, not on the same bed, separate bed, but same room. You don't need to use any monitors. You don't want to use any wedges or any positioners, and also you don't want to you don't want to expose your baby to um, smoke. You don't want to do alcohol. You don't want to do any illicit drug. And the effect of the illicit drug and the alcohol, it's not like it's going to affect the baby um, directly. Like it's not, the baby's not going to be on drugs or it's going to be smoking. No, it's just so you, the parent, will be in your right frame of mind and you'll be alert when you're with your baby, so you can protect your baby. So that's why you don't want to use any illicit drugs. And also, um, the baby has to always be on the back to sleep, always on the back. That's why you can't use any positioners or any wedges, and you don't put your baby with any extra blanket. You can put your baby on their belly daily, but the baby has to be awake, and you, the parent, has to be awake, and you have to keep your eye on the baby for tummy time. And also for nap times and bedtimes, you can give your baby a pacifier that can also prevent SID. So you want to do that. So now that I've talked about the SID, let me demonstrate how I'll put my baby on a halo sack. So this is the halo sack. You put the arms in the, it has a like an arm thing in it. So you put the arms in it, and then you put the baby's hands across, and then you will put the Velcro across like that. And this side, oh, I forgot to do the diaper. I have to put the diaper on the baby first before I put the halo sack. So I have my diaper here. The strap of the diaper goes to the back. The strap goes to the back. So you just put the back like that. And like I said before, every time you do a diaper change, you want to make sure you clean the baby with warm water, warm, clean water. You want to clean the baby's penis or the vagina from front to back, and the penis you want to squeeze water and pat dry before you put the diaper. You change the diaper. Make sure there's no rashes or any redness before you change your diaper. And like I said, with a circumcised boy, you want to put the ointment on a 2x2 gauze so the diaper doesn't stick to it. And because the baby has umbilical cord, I'm going to fold the top of the diaper, fold it, and then put it under the umbilical cord. So the umbilical cord will be dry and it will be easy accessible. So now that my diaper is on, I'm going to put the Velcro on. Oh, I said about the halo sack on. So the babies, you put the Velcro across. Like I said, you put the arms in, you put the Velcro across, and then this side will come here to stick. There's a thing that will stick to it, and then you do the zipper in there, in here first, and then you will stick. This will keep your baby nice and warm, so you don't need any extra blanket or any extra beddings. So now that my baby is nice, roughly nice in the halo sack, I'm going to demonstrate how I'll hold a baby. So this is a cradle hold. The cradle hold can be used for feeding the baby, bottle feeding or breastfeeding. You can use the you can use the cradle hold to hold your baby. And this is also good for eye-to-eye contact with your baby. It's very warm, and it's also good for bonding or closeness to your baby. And the parent, you will have extra hand to do something else too. So this is cradle hold. This is upright position. This is very good for burping the baby after the baby eats. you want to birth the baby, this is very good for it, and it's very secure. And also, this is good for bonding and closeness to you and the baby. So this is also um, upright position. This is football hold, like I demonstrated when I was washing the baby's hair. It's good for shampooing the hair, and it's also good for just carrying the baby. You can do this, and this is also good for breastfeeding the baby. And if you had a C-section, this is very good to this is a very good position to breastfeed your baby. And if you have twins too, you can feed both of them at the same time, one here, and you can feed them at the same time. And if not, you have your extra hand ready. So I think I covered everything. If there's any question at all, you can always ask me, and I'll be more than happy to answer. Thank you very much.